In what might be the least surprising news ever, the health insurance industry has come out against Bernie Sanders' Medicare for All bill, S1804. I know, shocking, right? Who would have thought that they would vocalize their opposition to a bill that would potentially put them out of business? So according to The Hill, Rachel Rubin reports the main insurer trade group issued a strongly worded statement against Medicare for All ahead of the release of Senator Bernie Sanders' single-payer healthcare plan. Whether it's called single-payer or Medicare for All, government-controlled healthcare cannot work, David Merritt, executive vice president of America's Health Insurance Plans, said in a statement Wednesday. It can't work, guys, because the health insurance industry said so. I wonder if they have anything to gain from saying that. So, just so we're sure here, David. So, when you say that single payer can't work, this is based on a qualitative analysis that you did of single payer, right? It doesn't have anything to do with the fact that your industry has billions of dollars in profits to be made by keeping the status quo, right? So David here goes on to explain on behalf of all insurance providers why it can't work and what Congress needs to do to actually make our current system work. He states it can't work because it will eliminate choice, undermine quality, put a chill on medical innovation, and place an even heavier burden on hardworking taxpayers. The most effective way to ensure affordable care and coverage is to strengthen the private market's ability to serve the American people, whether it's building upon private plans serving nearly 180 million people who get their coverage through their employer, or tens of millions who depend on private plans that partner with public programs, Merritt wrote. Well, we're going to have to agree to disagree here because it actually doesn't eliminate choice. What single payer does is it expands choice because currently we don't really have a choice. If Americans get sick, then they either go bankrupt or they die. So we don't have a choice. Now we're fucked if we get sick and we don't have insurance. That's not choice. That's the opposite of choice. That's the illusion of choice. And by saying that the free market model gives us more choices, it doesn't give us more choices. Holding a gun to our head and telling us that we have to buy your shitty insurance plans that rip us off, that's not choice. And if it is a choice, then I'll opt for a different option, which is single payer. But if Americans are still inclined to purchase health insurance on the private market, then they can still do that. Now, I would personally abolish the private market to make sure that we don't have a two-tiered healthcare system so rich and poor people receive the same quality of care. But that's not what Bernie's bill even does. It still gives people the ability to purchase private insurance on the so-called free market. So the difference is that if they no longer want it or can't afford it, then they don't die or go bankrupt if they get sick. They actually get the care they need. So that improves choice. And I want to get to the solution that he gives us here because I think it's inherently hypocritical. He states that we need to strengthen the private market's ability to serve the American people. Well, you greedy pigs in the private market had your chance to serve the American people, and you decided that profit would be your motive and not actually providing healthcare to Americans. That's why people are dying and going bankrupt. It's because of your greed. So you had your chance to serve the American people, and you didn't want to serve the American people. You chose to serve yourselves instead. And furthermore, when it comes to strengthening the private market, we're already doing that. We are pumping billions of dollars into this healthcare system to salvage it and to prop up these shitty private plans, and it's not working. What do you think Obamacare was? The government pays to subsidize private health insurance plans, and costs continue to rise, and millions of people are still left out. So I'm sorry, there's no strengthening the private market plan. You have to take the profit motive out of it, which is why the private market will never ever work when it comes to healthcare, because when you economize something as important as healthcare, then you shift the goal of healthcare providers. You make it so that way they care more about profit. So the free market had its chance and it failed miserably, which is why a majority of Americans now support single payer and no longer trust these health insurance companies to take care of our healthcare needs. And CEOs of health insurance companies know their greed has catalyzed the push for single payer, which is why Brent Saunders, the CEO of Allergan, explained at a recent conference in Boston that companies like his have got to prove that the free market can still work. Otherwise, voters might finally say enough is enough.
You know, I think we've got to do things to bring that trust back, because ultimately someone's going to be in the White House, somebody's going to be in Congress, someone's going to be somewhere and going to say enough's enough. Let's just change the whole system. Let's go to one payer. Let's do something. Unless we really have shown that this model works, it delivers innovation, it delivers it in a fair and appropriate way, and they're good, strong, profitable companies.
It seems lately that the Democrats are starting to talk about a single-payer system more as a platform or an acid test for certain candidates. Are you seeing that the same way? Do you think that there has been an uptick in that type of activity, or do you think, no, this always happens around elections?
No, I think, my view is that unfortunately, the party that seems to be out of power tends to move dramatically to the left or to the right, right? We saw it when the Democrats, in Obama's first term, when the Democrats swept, we saw the Tea Party emerge, right? And we saw a real push to get more conservative candidates through the primary system to really be, much more conservative. We're seeing almost the equal but opposite reaction here now that they've been swept out. The left of their party is really gotten a louder voice and taken control. And so, Bernie Sanders and others in that movement have really tried to vet candidates, on the opposite side of the coin as the Tea Party was. So we're seeing the divide go further, and clearly, they want to go to that part of the party wants to go to a one-payer system. The problem with that is it's not going to happen, and then the farther they go apart, the more polarizing it becomes. And so do we actually get a practical solution? Do we actually get to helping the people who need it most, right, to get into a system that actually works? I think I become more discouraged.
So I love the pseudo-confidence that he expresses there, because at the beginning of the clip, he expressed concern that Americans are getting fed up with the private insurance industry. And, we're going to say at one point, enough is enough. And we're kind of on the verge of saying enough is enough as a society. And I would argue that we've already said that because a majority of Americans now support single payer. But towards the end there, he said, well, this will never happen. Oh, it's going to happen, all right. You need to start looking for a new job right now, Brent Saunders, because we're done. We are done with the greed and the power that you guys continue to exert over all of us Americans. You buy our politicians, and you continue to rip us off, and you don't even care that people are going bankrupt and dying because they have insurance from you, but it just doesn't cover some random medical emergency that they had. So that's done. Those days are done. The days of the health insurance industry ruling America are of the past. So single payer will happen, and the greed of CEOs, it's just super transparent. So I love that they came out against Bernie Sanders Medicare for All bill. I expected it, but I'm glad that they're doing this and vocalizing their opposition to it, because they're really showing their true colors as if they hadn't already. But you are just proving our point for us, and you are making the case for single payer even easier for us. You don't care about healthcare, you care about money. That's why we have to abolish you and go for single payer.
Support this podcast by becoming a patron at patreon.com/Humanist Report.